Aloha and good morning. Thank you so much for joining us here for the COVID-19 Care Conversation. This is a conversation brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health. It's a place for us to bring leaders and experts who are fighting the coronavirus and dealing with the response to the pandemic here in the islands and hopefully get you some answers. We're so lucky, Ryan, we have Scott Murakami on again today.
That's right. He's become our regular guest every Tuesday here on the COVID-19 Care Conversation. Of course, we also would like to thank our sponsors who have made this conversation possible, the Hawaii Executive Collaborative, as well as Hawaii Pacific Health, for allowing us the opportunity to have this conversation and to give you the access to these leaders. And so we encourage all of you. We know that Director Murakami is one of our more popular guests and that we always get a bunch of comments. We will try our best to get to as many as we can. We also went back through the last show that had 353 comments and tried our best to condense and consolidate some of the ones that we did not get to. So we're going to be mixing in a combination of questions that were sent in, the ones that were entered last week, as well as the ones that appear today. So we will try our best, but again, encourage you to input your questions, and we will get to as many as we can. Of course, really quick off the top, we like to talk about the number of cases. Again, another day of no new cases. Total cases here in the state of Hawaii of COVID-19 remain at 643 positive cases.
Yeah, it's the second day in a row of no new cases, the sixth time this month. For Oahu, no new cases in 5 days. For Kauai, no new cases in 6 weeks. That is tremendous progress there. And another good news, another good statistic, 92% of those infected have recovered. So we really are flattening the curve and heading on that downward trend, which we love to see. Unfortunately, that all comes at a great cost when it comes to our economy. And to talk more about the unemployment process and give us an update, we're joined now by Scott Murakami, who is the Director of the Department of Labor and Industrial Relations. Thank you so much for being here, Director, and give us the latest. We always like to start with the numbers with you. How many claims processed and how many folks are still waiting?
Okay, let's see. As of May 25th, we have a total number of 251,418 claims. Of those, we processed 186,756 claims, which leaves 64,662 claims that are still in process. That's about 25% of the claims that we've taken in are still in process. So we've processed 75% of them now. Of those 186,756 claims, 137,188 claims have been paid on. And that leaves 49,568 claims that were denied. So that's where we stand now with just a regular unemployment insurance program. I will tell you to date, since the start of COVID-19 on March 1st, the regular unemployment insurance program has paid out $334,267,243.62. That
program, down to the penny.
Yeah, that program has also paid $381,183,000 out of our $600 plus up program. That was one of the CARES Act programs called FPUC. The other CARES Act program called the PUA program. That program has paid up to date a total of, as of May 25th, let's see, it's processed 35,144 claims or applications, and has paid out 136,701,401.32. So that gives you an idea of those two programs. Our third program, or the 13-week extension program, we've processed just under 600 applications now for 13-week extensions. So that's where we stand with the numbers.
Okay, we want to kind of already get right into it with some of the questions, because we know that these are always questions that people have. And one of them starting from Brendan asking, if I start work with another job, but not full-time and less than my previous employer, do I still qualify for some partial unemployment benefits?
So, Brendan, it really depends on how much you get paid and what your weekly benefit was when you're collecting unemployment insurance. And if the pay that you receive is actually less than your weekly benefit, yes, you would be able to continue to receive your partial unemployment benefit.
Patty Anderson, and I'm seeing a couple questions here that are similar. I have not gotten any updates on my claim from April. It states pending. Why? I've sent emails, no response. Why? Joanne has a similar question. It says processing, but it never actually gets paid. So for these folks who are in this pending status, what's the timeline for them, and what should they do to make sure that they actually do receive the money that they're entitled to?
So on the claimant side, you have to make sure you process your sort of weekly certifications, and if you've done that, I can tell you that the pending status is because the claim is actually an examination as one of the situations in which we have to make an adjustment to it. So this, in all likelihood, the claim is being reviewed for the reason for separation of service. That's the number one issue that we've been seeing more than anything else at this point. Those are the claims that are really challenging for us because it really does take some fact finding. It requires us to extend time to both the employer and the claimant to respond to us. That's actually required by statute.
How many folks do you have on your team right now processing all of those claims?
Well, it varies day to day because the schedule shifts, but on average, it's about 300 people that are processing claims statewide.
And how many new claims do you have? Last time you were here, you said it was 1,000 to 2,000 a day of new claims that were coming in. As we're starting to see businesses reopen, is that number going down or is that staying steady?
It's actually going down. Let's see. I'm trying to do this on the fly. It was about 900 the past 3 days, I would say, on average.
Okay, that's good to hear. People are getting a little bit back to work. I had a question about the folks who are getting back to work, and this is similar to the question that Ryan just put up a minute ago. If you do go back to work, but you're still pending for the time that you missed, or you haven't gotten around to actually filing a claim, you haven't been able to, how long do you have to actually file for those benefits? At some point, do they expire, if you will? Is it within a calendar year? Is it within 6 months? How long do you have to actually make those claims?
So as long as they filed the claim with us, we will make sure that the claim gets processed, even if they go back to work. But I didn't think there was a statute. I can double check that for you. I don't think there's a time period in which, as long as you're in your benefit year, I believe you can file for it. So I would have to double check that for you, because I assume what you're saying is that let's say somebody actually qualified for unemployment but never filed a claim, and when they need to file that official claim is, I think, what you're asking. And that's a really unusual case. Typically, people file right away, but I haven't heard of very many cases where they'll just wait and then retroactively go back and file. Normally, people will file their claims, right as soon as they can, which is now we don't have the 1 week waiting period. So they would normally file it as soon as they're separated from duty. But I can check that for you.
But what I'm saying is, even if they do go back, if that time period that is pending or they haven't been paid out, they will eventually get that money.
Absolutely.
Assuming that they have they can make their case.
Yes, absolutely. Once their claim is filed, we certainly will do all of the things necessary to properly assess it and make the necessary adjustments to it. And if they're entitled to benefits, we will pay the entire amount that they're entitled to. It's just it's really unusual for somebody to be separated from duty and then not file their claim timely. But assuming that they have filed their claim timely, then yes, we will pay that claim as soon as we can, and certainly pay the full amount that they're entitled.
I want to bring in another question here here we go. It says, we were disqualified, and it says ineligible as failed to meet work registration requirements. What does this mean, and what do we do now?
So work registration requirements. So so my best guess on that is that either the employer didn't register, we couldn't match your monetary requirement up. So what that means is that we couldn't match your data up with your employer. So either the employer has filed under a different name, or the employer did not pay into the unemployment insurance trust. That's why the individual was disqualified, and that individual then could apply for the PUA program, and then we would do the necessary match to make sure that they're eligible, and then assuming that they are, we'd pay them through the PUA program.
Alicia Dorego says the DMV can reopen. Why not unemployment? When do you anticipate actually having some in-person services?
Yeah, that, we're still in the planning stages with the administration, with the DAG's office, as well as our own internal planning. Part of it is we want to make sure that, number one, we abide by all of the public safety requirements and the public health issues. So any kind of social distancing issues that come up, we want to make sure that we can accommodate that within our building. I can tell you that we are looking at what we can do from an online appointment system. I'm not sure. I don't want to promise anything yet because it's still in the discovery stages. But that's one thing we are looking at. If we could open up with by making sure people had a chance to set up an appointment and then come based off an appointment time. But the other thing is, the two things that we're really considering is, number one, can we ensure the public safety, and number two, making sure that our staff are safe as well, and that we have the necessary safety measures to ensure social distancing.
I want to follow up also on the question from last week. We know that some people were able to be brought back on work because of the PPP program and that loan, and employees were able to do that. So the question is, can they still claim to receive PUA benefits even if the business that they had worked for did receive a PPP loan, maybe prior to before the PPP kicked in or after?
So they can qualify only for the period in which they were not called back to work. So once they're called back to work and the business has received the PPP loan, then they would have to go back to work. But you can't get both. So it's either one or the other. In the period that you were separated from work, you could qualify both for UI or for PUA, depending on your individual circumstance. But once the business gets PPP, regardless of whether you're in the UI system or in the PUA system, at that point, you would have to return to work.
Someone by the name of Geisha Waikiki is saying, please address when rideshare drivers must return to driving. For the folks who are self-employed, it's not like they get called back to work. I know Uber was sort of in this gray area where they were applying through UI as well. But can you start with the Uber question specifically for rideshare drivers? Are they required to go back to work at any point?
So that, I think, is more set by policy and how the state opens up services. I don't know particularly when they would be called back to work or when they would be when they should go back to work. What I can tell you is that under our unemployment insurance program, Uber and Lyft drivers are considered to be covered employees. So what that means is that they actually do qualify for regular unemployment insurance coverage. And this is beneficial to them because outside of COVID-19, if they were unemployed for whatever reason, we still paid them benefits. What's tricky for Uber and Lyft is that we don't always get their wage data timely, and it delays the process for them to get benefits. But what they can do is, if they just log on to their portal, there is a way for them to access the wages they received. And if they send that to us, we use that to make the monetary determination on what their benefits should be, and we will pay them out timely that way.
For the folks who are self-employed, they're doing and they're receiving those PUA benefits. If they get a gig, let's say, these are people who have multiple employers, if you will, but contractors.
Right.
If they get that, if they, they're a musician, let's say, and they get a one-off gig, will they not qualify for that particular week, or how does that actually work? Because they work for so many different vendors.
Right. So it really depends on the amount that they're receiving on their weekly benefit. So as long as the amount of the gig doesn't exceed the weekly benefit amount, they'll continue to receive it. So it's very similar to our UI program in that respect. I can understand where they would be receiving multiple gigs and they get a few of them back, but it really depends on the amount they actually earn during that week relative to the weekly benefit that they've been entitled to the PUA program.
And is that the $600 plus that base pay, or is it just the base pay?
It's actually just the base pay portion that we had calculated off of.
Okay, so that $600 goes away if they earn more than the base pay.
That's correct.
Okay.
I want to bring in another question here from Christine, who's asking, do you folks expect a surge when the 8-week payment protection program loan runs out? We know that businesses were able to bring people on, but some of them still not in a position to be able to sustain the employment maybe that they did. Are you guys ramping up, or have you heard anything maybe from the federal level? Is there any more relief coming, or what insights can you maybe provide on this?
So I guess the best way to put it, Christine, is my suspicion is that we won't see a real surge of it. I guess there may be a gradual increase of claims that people file again because they've been brought back. They've maybe were released from work after the PPP program expired. But what had happened is, if my timing serves me correctly, I believe that the PPP program actually came out later after a lot of people had claimed benefits from us. And so I think we may have captured them in the initial run-up of claims that we had. What I can tell you in terms of how we're dealing with preparing for any kind of upcoming surges is, I think I've explained that there are two elements that really created the latencies or the system degradation we saw. One was on the web front end, the web portal. That was about 10 years old, and that used old screen scraping technology. The other is on the application that resides on the mainframe, and that is the technology that's antiquated as well, and it's about 30 some odd years old now. It's built in 1986. So what we've done is, first thing we did is we modernized the whole front end web portal. So we're shifting off of the old portal, and even though it looks the same, we're putting onto a new SQL environment. So that SQL environment actually hits a replicated database that synchronizes with the mainframe. Then on the mainframe side, a team has got together to actually make sure that the mainframe is tuned, and they've given us a little more resources there. So overall, I think those solutions, we can't really modernize the mainframe system, the application that resides on it. We're pretty much stuck with that for at least the next year until we fully modernize the system. But what we could do is we could modernize the front end web portal. And that's what we've done. So we are looking at mid-June as the time in which we migrated all of our services off the existing or the antiquated portal into this new SQL environment. That's what's allowed all of the residents to file their certifications on time. They've been able to file their claims now on time. To give you an idea of what it was like, I think we paid something like 70. Let me just pull this up real quick. Yeah, on Sunday, we took in about just 72,539 claims in one day. Claim certifications, excuse me. And that number used to be about 20,000 on a good day. So you can see that the capacity has significantly increased. We did not see any system degradation on Sunday. People, again, to kind of complement that, we put in the alphabetical listing. Mm-hmm. So my anticipation is that to the extent that we could build new technology systems on the fly, make sure that we try to make sure that any new surges we can manage, at least in a more effective way. We've been able to accomplish that. At least come mid-June, we should have all of our services on the new front-end web portal.
Eva Ramos says, if you move out of state, can you still collect PUA, and what is the process? Since many self-employed can work from anywhere and there's no work in Hawaii, many are looking to move somewhere cheaper where there is work. So what do we do?
So I believe you still can file for both UI or for PUA. It's just that we would have to get in touch with you to verify your address, because those are some of the trigger points that we make sure are accurate and that we don't have people filing out of state. I know for the UI system, they have something called ICON that does a cross-state verification. And I believe PUA does that verification as well. So you would be able to file it even though you moved out of the state. We did have a number of people who had done that. They moved closer to be with family during the time of the stay-at-home orders. So we did have some people filing from outside of the state.
And Paige has a question here. If we made a mistake on our claim, can we fix it? Some people may realize that they filed an error. Can they fix that claim? Do they have to file a whole new claim? How does that work?
So at this point, you would have to wait, Paige, and work with our staff. Our staff are trying to call back everyone who has made mistakes. I can tell you if there are minor things that we can repair, we try to fix it on the fly, but there are certain things that, we've seen happen that we do need to call claimants back for. A lot of that has been things like the ones that we can fix quite without assistance is, for example, if there's clearly a monetary issue that we can repair where the employer was identified incorrectly, we can do those types of repairs. But if there are some issues that have popped up, like somebody, we've had people who filed the wrong SSN number. There are people who actually have filed the wrong, their address and personal information is incorrect. A lot of that, we actually have to get in contact with the individual, call them up, and then repair their claim.
I want to pull a question in that we got submitted before from last week from Jada. She was asking about the options for people who were in between jobs before this even happened and now cannot find work because, of course, there are a lot of people that are unemployed. And so, just a job overall workforce is hard to find a job. What are some of the options for those people who are already unemployed? Maybe time is running out for their unemployment benefits, and because of COVID has made this a little bit more difficult to find work.
Sure. So if you were unemployed from after July 1st of 2019, you actually would qualify for the pandemic extension program. So basically, all you have to do is go into your portal, and there's a button you can click on now that provides the PEUC benefit for you. So if you click on that button, it'll ask you 5 questions, and those 5 questions are what determines whether or not you qualify. That's what I would encourage you to do. I don't know how long the period in time is that the individual has been out of work, so it's difficult to determine whether or not they'd be eligible or not, because if it was a long period of time, then that does impact the eligibility period and then subsequently the benefit package, the benefit determination that they would have. So that all being said, if it was something that happened after July 1st, 2019, make sure you go into your portal and apply for that 13-week extension period.
There's a question from an employer. We haven't had this one. This is Suzanne Johnson Green saying, how can an employer find out which of their employees is still claiming unemployment, even if they have come back to work?
That's an interesting question. I think I'd have to check on that, Suzanne, because they should be filing their low earnings report. So it should be stated on top of their application on when they log into their portal, into the business portal, and they file their low earnings report. They should be able to identify which employees have gone back to work. Now, but determining which ones are still getting benefits, or I guess you could infer from that report that if they're on there, that they're still getting the benefit. But outside of that, I don't know if there's a unique report that would be available for them, but that's how I would do it. It would come through the low earnings report that they file.
We're sort of running out of time here, so I just wanted to ask you there seems obviously to be still a lot of people who are trying to get through, who are waiting on calls, waiting on, the backdate email question again keeps coming up about people waiting for a response to that. And I know that you have Neighbor Island teams working on that. What would your sort of as a final message be to those people who continue to wait? Is there anything new that they can do, or is it sort of just continue to just kind of hold on?
So there are a few things that I would suggest to people. So first of all, for individuals who have filed claims but have not, and you got your email back, you have to remember that it's important that you file your weekly certification. There are a lot of people out there who actually have not filed their weekly certification. Last count, I think it was early last week, there were about 9,000 people who actually had filed claims successfully but had not filed a weekly certification. Now, some of them that when we've called have told us they actually went back to work and never needed to file their weekly certification. But I will, if you haven't received any benefit, make sure you have your online account set up and that you are filing your weekly certification. We did have some people telling us that they kept filing initial claim forms, thinking that was the weekly certification. So please go on and make sure you follow the weekly certification. That's the first thing. I will tell you that the other thing I would suggest is that, we've been calling back quite a number of people who haven't been picking up the phone. And I think it's because I don't know if they just aren't certain who's calling and whatnot. But I would encourage you to just answer. A lot of times it's our unemployment specialists who are trying to call you back, or other state employees who are reaching out that are working in the convention center to help you address some of the issues that you may have. I know that we are running down calls much more rapidly. I think last week we were addressing about taking in and responding back to about 2,000 people a day. So I can tell you that our response rate has gotten better thanks to an increase in the number of phones that we have and the expansion of the call center and the convention center, and thanks to a lot of people coming out to help us and who are working in the UI capacity now. Again, I know it's tough. I appreciate everyone being patient, and it must be even harder knowing that we've gotten through 75% of the claims and we haven't gotten to yours yet. I can tell you at this point, those are the ones that are the most challenging for us because they require us to do a higher level of adjudication, but we will get there, and I appreciate everybody's patience and understanding.
All right, Director Murakami, thank you so much once again for taking time with us here on this Tuesday to answer some of these questions, and we look forward to another update again in the future. Mahalo.
Aloha.
Well, good to hear 75%, but he's right. For those 25%, and I'd imagine that a number of people who are writing in here are in that number, and it is very frustrating. I see some of you writing that you never have received any benefits and you filed from day one. So it sounds like they do have a team that is working, and that processing 2,000 a day or responding to 2,000 a day is quite an achievement, and they are making progress. But still, for those 25%, quite frustrating.
Yeah, and I think one of the things that they're trying to do, obviously, is just kind of move along as they modernize things, as they're implementing new plans. And so, again, he's saying that some of the ones that are continuing, maybe the people that are waiting, are the more complex issues and more of the complex claims that they're having to manually go through, as well as following up with the employer and making sure that the employer is being accurate and timely in their responses to these claims as well. So we will continue to try to keep him posted. Again, Scott Murakami is one of our most popular guests because of the volume of comments that we have coming in. A lot of them having to do with the same types of questions that we see every week. And so we will continue to ask those questions and try to get to as many as we can while incorporating questions that we may have missed in previous weeks. But we encourage you to go back and watch past episodes, because there were some of the things that are being asked now that were addressed also in the past as well.
Yeah, and he's been on every Tuesday for, I think it's like the last 6 weeks. So yeah, we appreciate his time, and we appreciate all of you writing in your questions. Please continue to write them in. Some of them seem also about, some of them are in the weeds just about your personal circumstance. Some of them seem broader policy questions. So we have Lieutenant Governor Josh Green on Thursday, and then Scott Psyche, Speaker Psyche on Friday. So between those two, we should be able to answer some of those broader policy questions as well, hopefully on Thursday and then on Friday. Another interesting article in the paper on this same topic is that the mayor of the city and county of Honolulu, through Mayor Kirk Caldwell, has committed $50 million in coronavirus aid, the CARE money, to help small businesses and hardship relief for individuals. So there's information on both programs at oneoahu.org, and the paper does a great job of laying out which kind of businesses can apply, and also which individuals can apply. This is a way for you to get some money to help pay your rent and cover other household expenses. Or if you're a business, it's a way for you to get some money to help you stay afloat.
Yeah, we also know that system also had some glitches because of the large volume of businesses that were actually applying for that program. And so the mayor, as well as the partners that are involved in that initiative, are working to make sure that they can provide that money and those grant money for those small businesses that are having to make these COVID adjustments to their physical space, and to help to relieve some of the costs that are involved there. In other headline news, of course, one of the things that a lot of people are looking forward to is the return of sports and somewhat of a normalcy when it comes to athletics. And the University of Hawaii's new head ball coach, Todd Graham, said that he is hopeful that his football players will be allowed to begin by appointment workouts at school facilities in June. Now, last week, the NCAA Division I Council approved a measure that would open on-campus workouts for student athletes beginning June 1st. Or if the voluntary workouts will be implemented with the rest of the government guidelines that Hawaii has put in place, as well as with UH David Lassner, is still being worked out in sort of our current climate. So the football team hoping to get back in it. It still remains a question as to how they will compete, especially with teams having to come to travel to Hawaii. If there is still that 14-day quarantine that is mandatory for anyone coming to the state, obviously that will not work for any team coming to play the University of Hawaii, not only in football, but maybe Wahine volleyball and other athletic sports. So we also are trying to get to speak to Director David Matlin and get an update from him as well on what they are trying to do to adjust into this new scheduling, especially with the amount of travel that's involved with the University of Hawaii and their sports teams.
Yeah, just incredible to think of all the hurdles, logistics and otherwise that they have to make. But good to hear that at least some of those guys will be able to get back into the gym. I'm sure they're itching to work out in those facilities. And even if it is one at a time, that is still better than nothing. So we're happy to see that. We'd like to talk about our Hawaii Hero of the Day. And today we want to highlight a program through the Hawaii Community Foundation and First Hawaiian Bank. It's the Stronger Together Hawaii Scholarship Fund. It's $1 million, and they're hoping that other organizations and donors will join them. It's to help Hawaii public school students who are graduating this month to get a boost on their careers through a scholarship fund today that will offer flexible aid tailored to each student's needs. Now, this is a really excellent program, and the paper has a great write-up on how exactly it works, who can qualify for it, and what the money can be used for. They're really flexible. This is not a traditional scholarship program. It's not limited to tuition and materials or job training. It can also go toward emergency expenses that can threaten to derail a student's education, and there's no minimum or maximum amount per student. So we encourage you to take a look at hawaiicommunityfoundation.org/students. That has a lot of information about the scholarship itself, and you can read the full write through in today's paper. Great to see the Stronger Together Hawaii Scholarship Fund coming together with First Hawaiian Bank and the Hawaii Community Foundation.
Yeah, so mahalo again to the Hawaii Community Foundation, who has been doing a lot. I mean, this is a time where we need those organizations like HCF, like Aloha United Way, and they have been stepping up in various ways to help the community and partnering with these organizations. So again, we mahalo them as well as all those Hawaii heroes, and encourage you that if you have someone or you know some good that is happening here in the community and would like maybe to get the word out about some of the things that are happening or services that are available, we encourage you to leave us a comment, send us a message so that we can highlight some of these good things, because for all the sometimes doom and gloom it seems that we report here with all the things that are happening related to COVID, there's still a lot of great things that are happening in our community. And so we want to continue to bring that to the forefront through our Hawaii Hero segment. Again, we are looking forward to continuing on in this conversation tomorrow. We have a doctor that's going to be joining us.
That's right. Dr. Huidi Shu, I hope I'm pronouncing that right. He is a neurologist, and May is National Stroke Awareness Month. It's been very interesting to see. We've all been so focused on COVID that a lot of other procedures may be neglected, and people who are having symptoms, let's say of a heart attack or stroke, they may not actually be getting the medical care they need. They may be avoiding the ER. So we're really excited to talk to the doctor about how we can continue to stay healthy and get an update in that front, again, because May is National Stroke Awareness Month.
That's right. And then following that, on Thursday, we'll be talking with Lieutenant Governor Josh Green, specifically talking to him about some of the efforts that the state has to reopen the state. We know that there is a lot of questions that continue to come in about the inter-island quarantine, the visitor quarantine from out of state, as well as some of the other businesses that are waiting to open. A lot of people asking for when is that 10 or less group size going to be allowed. We're seeing it in other states. Technically here in Hawaii, it is still not open, but beaches obviously this weekend packed with people. So a lot of those questions about policy and implementation of how they are going to be rolling out sort of this reopening of the state, that can be asked to Lieutenant Governor Josh Green on Thursday. And as Angie said earlier, we're talking to Speaker Psyche on Friday. So another full week still ahead of us here on the COVID-19 conversation.
We encourage you to continue to socially distance, wear your mask, take care of yourself, take care of each other. Know that the more we comply, of course, the faster this will all be over. We love seeing those zeros, so let's continue to practice those safety measures so that we can continue to wipe the virus out of our community. Until tomorrow, we bid you a fond aloha and stay safe out there. Take care of yourselves and each other.
We'll see you tomorrow. Aloha.